Why is P1NP important for osteoporosis diagnosis? Imagine trying to understand how your bones are doing without looking at their density. That's where blood tests like P1NP come into play. P1NP, or procollagen type 1 N-terminal propeptide, is a blood marker that tells us about how quickly new bone is being made. Since about 90% of the bone protein matrix is made of type I collagen, P1NP is released when the body synthesizes this collagen. This means that measuring P1NP gives us a direct glimpse into the activity of bone formation. In osteoporosis, especially in women after menopause, there's often an imbalance between bone breakdown and bone building. Usually, bone resorption or breakdown exceeds formation, leading to weaker bones and higher fracture risk. P1NP helps us see if bone formation is keeping up or falling behind. If P1NP levels are high, it can indicate increased bone turnover, which is common in early or active osteoporosis. On the other hand, if P1NP levels are low, it might suggest that bone formation is sluggish, which can also be problematic. This blood marker is especially useful because it can detect changes in bone activity faster than bone mineral density scans. While BMD measures how much mineral is in the bones, it doesn't tell us about how quickly bones are being formed or broken down. P1NP can show us if treatments aimed at strengthening bones are working by lowering bone turnover. When effective therapy is in place, P1NP levels usually decrease, reflecting less bone loss and more stable bone health. Clinicians often use P1NP alongside other markers like beta-CTX, which measures bone resorption, to get a full picture of bone health. International guidelines recommend using P1NP as part of the assessment process because it is standardized and widely available. It's important to note that factors like fasting before the test and the time of day can influence P1NP levels, so consistent testing conditions are key for accurate monitoring. In addition, P1NP can help predict fracture risk because high bone turnover is linked to weaker bones. It also allows doctors to see early signs of how well a treatment is working, sometimes before changes in bone density are visible. This makes P1NP a valuable tool for personalized treatment planning, helping to reduce fractures and improve quality of life. It's essential to remember that blood markers like P1NP are just one part of the bigger picture. Every person's bone health is unique, and results should always be interpreted by healthcare professionals in the context of overall health, medical history, and other tests. If you are concerned about osteoporosis or bone health, talking to a healthcare provider is the best way to get personalized advice and appropriate testing. P1NP provides a window into the dynamic process of bone remodeling, helping us better understand, diagnose, and manage osteoporosis effectively.